Dr. Chad Prodromos joins me now, someone who, among many things, in his many degree from Princeton, from Johns Hopkins, and more. Doctor, great to have you here. Right off the top, the state of healthcare today, and as I just said, the conversation has become so much more a part of people's lives, the awareness of this.
Good morning. So, yes, you're right. Our health system does a great job of managing and treating illness, but there has really been very little in the way of resources toward figuring out why the incidence of chronic disease is going up and preventing illness and what in our environment contributes. So he has filled a huge void in trying to address why we have an increased incidence of chronic disease, of autoimmune disease, of cancer, of autism and such.
You know, the need to understand how we get there, and I'll use obesity as an example. The fact is that obesity rates in America are significantly more than numerous countries, the EU combined as a union, the individual countries, and there are key differences to that. Yes, our food source and other things, but obesity is one of those factors that is destroying lives, literally destroying lives around the country. How do you see this being tackled under RFK's leadership in this new conversation, this new awareness?
I think there are a couple of things that are of paramount importance. The key to understanding the obesity epidemic is diet, and his efforts to focus on diet, just to bring awareness to diet, even to talk about it, is something that lip service has been given to before, but not much more. The other factor that's equally important is environmental factors. So there was just no question. If you look at the increases in these chronic diseases, obesity is part of it for sure, but toxins, environmental toxins, have been clearly associated now with a variety of chronic diseases, whether in our food supply or elsewhere. So just bringing attention to these and trying to figure out, why this is happening. And something else I'd like to mention is that his attempting to address root causes, for example, his initiative on autism. He has said that he's going to take several months, bring great resources to bear, great minds to bear, on figuring out why autism has been going up and try to figure out the cause. And this kind of attention just needs to be focused there. In addition, though, of the pillars of his agenda, he has talked about bringing other treatments that can have efficacy, but that our system hasn't really fostered much to bear. So again, our doctors do a great job. Our pharmaceutical industry has great drugs, but there are other treatments, stem cell treatment, for example. And this is our area of expertise. Stem cell treatment clearly is effective for many disorders in evidence-based studies. There is also a lot of non-substantive things out there and making promises where they're not effective. But by trying to shine the spotlight on it, to make it available to people where it's effective, I think he's doing a huge service. I was actually just in Washington, D.C. Several weeks ago. He had asked me to make some recommendations about how bona fide stem cell treatment that can help people can be made more readily accessible without, in his words, a Wild West environment, without allowing scams and things that aren't valid. And, it's a tricky proposition. But the fact that he's doing it, I think, is very important. This pillar, along with the other things that he's doing.
One of the things that's come more to light is in the way influence works or has worked for and against when it comes to the FDA, to these various agencies, to all of this within the healthcare environment in this country. And there has been and have been and still are a lot of questions about undue influence in the form of lobbying, pushing agendas, the fact that this doctor-patient relationship has another person in the room. And yes, I know people think of the insurance company as in the room, but the influence of whether someone wants to refer to it as big pharma or some special interest. And I'm not anti-pharma. We need a functioning pharmaceutical industry. I'd like to see it be a U.S. based more than otherwise. Yes, we can, deal with the global issues, but there has been undue influence and, evidence-based, something you mentioned a moment ago, evidence-based and long-term or latent effects seem to be out of the conversation for many.
Yeah, I think that's true. And so I think pharma focuses really on what it should focus on. It should develop drugs and treat people, and it does a great job at that. It's the other things that have been neglected where there hasn't been anybody to be an advocate for these approaches. You mentioned influence from pharma or others. It's hard to know. I'm a physician. I'm not a lobbyist. But what I can tell you is from my area of expertise and where I was asked to be involved, for example, bringing treatments that are helpful to the public more quickly, what we found in looking at the regulations closely is that FDA regulations, for example, for stem cell treatment, are designed to run stem cells through trials, to make sure that they're effective, make sure that they're safe and protect people. And I think those regulations are very good. What happens is that in their implementation, I think that they are interpreted in a way that makes the process of getting new treatments approved just phenomenally expensive. It's estimated that it's $19 million for studies of new treatments to work their way through. So this is more in how they're implemented. And so I think the regulations are good, but there just needs to be more of an emphasis on bringing things sooner. Again, speaking in my area of expertise, we have a research institute. We publish studies in good journals. We do clinical trials. And currently, we have had really what I would call amazing, and I don't use the word lightly, success in treating some neurocognitive disorders, ALS specifically, also Parkinson's, Lewy body dementia, but a disorder that there has never been a treatment with drugs to reverse symptoms, only to slow it down. So our results are early. They're only about 5 months out, but in a clinical trial using stem cells and also exosomes, which are a component of stem cells, we are actually having success in reversing symptoms. We've treated 14 patients. This has been consistent. We're very excited by this. So we are talking to the FDA. We talked to them yesterday, and we're treating people at no charge. So our goal is to try to get people treated as quickly as possible without having to wait years and years. So it's important that these things be tested for safety and for efficacy, but to try to expedite the process, similar to the idea of the Right to Try Act that was passed. So I think there just hasn't really been a voice that says, look, these are important. People are suffering. Let's expedite this process to get it done. As to whether there's backroom influence and lobbying, I don't know. It's beyond what I do. But I can say that I think that the means are there to get these treatments approved. That the FDA has been good. RFK Jr. has mentioned this in his in his public statements. So whether or not there is backroom lobbying, I don't know. But I think we can succeed anyway in making all these improvements.
Well, look, I like the things you talk about, evidence-based. That's important because science should be science, not a policy agenda. How do we get to a better balance? I started with the conversation, the awareness, right? You have to know that there's an issue out there. I talk to people, I'm sure you do every day, just, not professionals in some field or another. It's people who say, look, I'm watching not just what I eat, but where it comes from. I'm watching what I do. And if we don't solve it, in general principle, if we don't solve foundation problems that lead to health issues, you can't do, you can only do so much about certain things that may happen, right? Nobody knows. The bodies are unique and different, cancers and other things that can happen. But, how do we start to get a better environment as a society? And how do we actually make it happen, not just talk about it?
I think there's two avenues. The one is, so we know a lot of the basics about diet. It's well established that highly processed foods are not good for us. And so people say that, but there really hasn't been a voice championing it and trying to bring it to the forefront of conversations. And so I think that's the one obvious thing that can be done and that I think that he's trying to do. The other thing is taking steps to get things out of our food supply that don't belong there. Red dye number 3, which is recently being eliminated. It had been eliminated from other countries for years and years. So you could take steps to try to clean up our food supply regarding additives, toxins, things that have been associated with disease. And then on the other hand, just make it the forefront of dialogue. Our system and our dialogue publicly has focused on health care, which is incredibly important. But there's been an aphorism out there for decades and decades that basically says that only 20% of health outcomes are related to health care. The other 80% are related to lifestyle and environment. So, heretofore, the voices have been mostly about health care, and that's incredibly important, no question. But just bringing a voice that brings attention to these other areas is going to help. I think it's already helping.
Well, I hear a lot of good things coming out of HHS, out of RFK Jr., out of the public, and now the demand, Dr. Prodromos, has been by many that, we start finding paths. Some people are just later along in life. Maybe they can't reverse everything, but they can stop if you will, stop the bleed or stop the degradation. And I think we're on a different footing today. My concern is how long it lasts. People have short-term memories, and that's not in relation to a medical condition.
Yeah, that's true. I think, though, what I see in my practice, now people who are interested in stem cell treatments search and do research, and they find us. I think they find others. And I've been in practice for close to 40 years, and I have seen a change, the internet, obviously, that I think is a very positive change, that I think people now are doing their own research and investigating and paying more attention to what they put into their bodies. So I think this sort of organically is happening anyway, where people pay more attention to what they're doing and are searching for other answers, and I think it's going to help health outcomes.
Well, we will certainly be keeping a close eye on all of these developments. I really appreciate your input. Look, I have a left knee that gives me trouble. I might have to come see you one of these days. So you never know. You never know. You might see me knocking on your door at one of your locations. But I really appreciate you coming on.
Yeah, if I could just mention one more thing, and I greatly appreciate your having me. We are trying to spread awareness. For example, our ALS trial, which is helping people. There's no charge for it. If you would permit me, I would just like
Sure.
to mention to people that if they have interest or know someone who does, our website is thepsci.com. So that's thepsci.com. And this is a horrible affliction. We think, we are helping. And if people would like information, again, there's no charge for treatment. We're just trying to help people and spread awareness. We have a newsletter that gives updates. So anyway, we are happy to try to increase public knowledge.
You know, Doc, I really appreciate that. As a matter of fact, a friend just told me that their friend was diagnosed with ALS. If you will, make sure my guys have the contact information. I'll be happy to pass that along.
Great. Great. Thanks for having me on. Thanks for everything you do.
Dr. Prodromos, Chad Prodromos, and again, you heard the information there, but we've got to make America healthy again, and that's all of us, not just at the top of the chain or the doctors. We all have a role to play in that. 866-95-PATRIOT, 957-2874. We'll get to the calls. I know I got a lot on my mind today. I want to do a lot more talking, but I got to take some of the calls. I know. 866-95-PATRIOT. Hang on, I'll get you on the other side.